Perfect, thank you. Um, my name is Martin Thyssen, and together with Julika Loss, we will give the presentation today. We are leading the work package 3 on the evaluation in the joint action, and we are working at the Robert Koch Institute in Germany, which is the National Public Health Institute, in the Department for Health Monitoring and Epidemiology. If you have any technical questions or problems, please reach out to Svenja. She will do her best to solve these problems. And with regards to question, we will have a Q&A session after the presentation. So feel free to raise your hand. That should be possible. Then you can ask your question live or post it into the chat and we will take it up and answer it. Okay. There are no questions. Then we will start. There are many out there. There are many definitions of evaluation in different topics and in different concerns. So we chose this definition for today because this describes nicely what we are doing within the joint action. And it comprises that we critically examine the program by collecting and analyzing information about our activities, but not just the process, but also the outcomes and impacts of the project. And to do so, we will be able to make judgments about the program, if it was successful, if we failed in some areas, to really improve also during the project duration its effectiveness and inform political decision makers by our results, but not just those. We also want to enable stakeholders to act on the findings that we will provide, that our activities are really getting into the field in the settings that they are needed in the later stage. Next slide, please. What did we do to plan the evaluation? I know that there are some colleagues today from other joint action, other European projects that maybe can profit from what we have done. And so we wanted to let you know how we got our ideas, how did we start, at what stage are we right now. So the first step that we did is this is a really complex program and a really complex and heterogeneous joint action. So what we did at the beginning is we described the program and also the contexts that the program is acting in, and clarified the aims and also interlinkages to other initiatives on the European level, which is really important because we don't want to be redundant. We want to be innovative and add to what is already out there in the field, and also collaborate, for example, with the Joint Action on Cardiovascular Diseases and Diabetes, JACARDI. We are working closely together, that we are not redundant and that we are really building on other activities that are out there. And the second step was to develop a logic model. If you take a look at the work packages and tasks and subtasks and pilots of the joint action, we looked at it and developed a logic model that Julika will show in a short time. So we are linking the intervention elements to the intended results of the joint action by developing this causal model. And in the next step, we identified relevant evaluation questions. This is not just what are we asking, but it's also who are we asking? Who are we reaching out to? Yeah, there are stakeholders out there that want to profit from our activities, but there are also our participants within the joint action in the member states, the work package leads, the task leads. So we had to decide what questions are we asking to whom. And building on that, we developed measures of different levels that I will show on the next slide, but it's not just process. It's not just process monitoring and progress monitoring, but it's also the outcomes and impacts of the joint action. In the next step, we decided on procedures and methods that are needed to obtain these information, and we are putting them right at the moment into a study protocol, meaning the question contents, the addressees, but also data management processes and analytical pipelines, and what measures we are going to use to do so. In the next step, and this is going to be the data collection step. This will start by next year. And this is what we will use to gather all the evidence and the information and the data needed to answer questions with regards to process, output, outcome, and impact. And then, of course, as soon as we collected the data, we will analyze and interpret the data. And this is nothing that we just do within our activities. It's also something that we will talk about with the with the respective stakeholders, because we need them on board to interpret our results the way that it's useful for stakeholders in the field of public health to act on those findings. And last but not least, we are making conclusions out of it. We are making conclusions, and these conclusions will be disseminated in formats that are tailored to the target group needs, right? And we will also provide recommendations for political decision makers to show the added value of our activities in the last 4 years. This is the stepwise approach. And on the next slide, this is the step where we are right now. We are between step 5 and step 6. We are developing the study protocol and start the phase of collecting data. What are the objectives of the evaluation? I talked about the different levels that we are acting in, and this is starting with the process management, with the process evaluation, and this is mainly carried out by the Work Package 1, by the project coordination in Norway, but we are working closely together, and we will synthesize the information on the process of the joint action and put it into our interim and final evaluation reports for sure. And what questions does this include? It includes that the project proceeds as planned, and are there any barriers or challenges or pitfalls that arise, and how can we solve those challenges within the project duration? The second level, which is important, is the outcome of the evaluation of the outcome. Are the project goals reached? And were we successful? And were activities, especially pilot activities, implemented successfully? What did we need to implement them successfully? What made them successfully? And the third level is the impact of the joint action. And as you can imagine, within the 4 years project duration, it's hard to measure hard impacts. Did we achieve something? But we will try to measure sustainable changes that could have been reached with regards to political decision makers, but also on the level of society. And the level that is also important for us, and this is why it's included in these objectives, are outputs. We are developing many guidelines, best practices, tools, scales, measures, and these tangible outputs should be meaningful, right? Should be meaningful, should be useful for other colleagues working in the field of public health. So we want to measure their quality. Is this of high quality, and is this accepted, or does it need to be adapted in the end? So these are the 4 levels of evaluation, and with that, I would give the floor to Julika.
Yeah, thank you very much. So this sounds very simple, the 4 levels, but when you start looking into our grant agreement and all the pages and pages and tasks and descriptions, this really rather quickly becomes quite complex. So we have, as you know, 10 work packages, altogether 60 tasks, 143 subtasks, and almost 100 pilot projects. So how can we actually make sense of all these projects and subtasks in some sort of order that helps us get an idea of the evaluation? And we discussed that in the beginning of the evaluation study design process, and we came up with the idea of clustering the main activities of the joint action. What do we mean by cluster? So we found that whatever the task is, may it be on smoking, may it be on alcohol consumption, may it be on physical activity, may it be on the community level or campaigning, whatever activity we have, we see that there are similar activities across work packages, across risk factors, across intervention types, and across tasks. The first of the cluster is the cluster of improving the knowledge base. So in almost every subtask, the work starts with mappings, with best practice models, with reviews of what has already been done in other countries, putting together evidence that is out there. So this is the first step in almost all work package, and I think this is really valuable for the success of the joint action. The second cluster that we identified is capacity building, because most tasks do not stop at just mapping reviews or mapping evidence, but also putting those ideas and the evidence into hands-on guidelines, into toolkits, or in setting up networks that can help implement certain prevention programs in member states. The third activity is practical prevention programs or interventions that can be done in communities, in schools, or using campaigns and communication methods. And these are mostly done in the pilot projects. And the last cluster that we identified is on improving the monitoring systems that are out there, especially monitoring of risk factors and disease prevalences by harmonizing questionnaires or questionnaire items, by harmonizing constructs, establishing new scales, etc. This clustering really helped us when we started developing the logical model, or we called it causal model, in which we try to put all the activities of the joint action into a sequence of action that will eventually lead to the outcomes that we aspire to, which is reducing social inequalities in cancer and NCDs, etc. Of course, this is only a model. This model really simplifies the processes that are involved, which is quite clear and obvious to us. But I think it's nevertheless useful to have such a simple model to understand what we are doing and why we are doing things in the joint action. So in this model, we're looking at what the input is. And the input clearly is the expertise and the experiences that all the participants in the different work packages and tasks bring into this joint action. This is our asset, this is our input, and not only the experiences, expertise, but also the exchange of these ideas that come together. And on the project level, we see that in the joint work of the participants, and on the country level, this will help every country to gain experiences and skills and see what national assets are there and out there. So what is the output? The first output is, as I just said, this is the cluster of information, knowledge, improving the knowledge base to review what is out there in terms of best practices. So we can bring all member states up to the same level of information and identify best practices across countries and see what may be effective policies. And on the country and member state level, this can help fill knowledge gaps and raise the awareness of best practices that are out there. The next step is to provide practical guidelines for prevention, for example, in terms of toolkits, of recommendations, of guidelines, in order to support member states in setting up preventive initiatives on their own. So the countries and the member state levels can benefit by this, by having some really hands-on resources that they can act on. The next level is the pilot projects, which really start with practical interventions in settings or in communication strategies. And I think it's really important to test these pilot interventions with a view to maybe rolling them out across other countries, scaling them up to other settings. So this is really important to have a look at these pilot project and see whether they are worthwhile being copied or transferred to other countries. This can give the member states a good idea of how interventions can be performed. The fourth cluster, streamlining, harmonizing monitoring systems, can enable all member states to collect valid data, but also data that is comparable across country borders in order to be able to monitor NCD and cancer prevention effects. So every country after this joint action should be in a really good position to monitor also local changes and put them into a reference with other countries. And at the outcome level, it is really important that member states start to act and engage on change within their countries. So the work package needs to support actions in member states and try to initiate community involvement in the member states, so the countries are really enabled to plan concrete NCD prevention activities and to improve their data systems. And also, this is the ultimate goal: reduce social inequalities and being able to monitoring and evaluating change over the years. So this is the model that we implemented, and this is really helpful for us to ask the right evaluation questions. So what we will look at: outcome and impact. So we start with outcome and impact. Martin has introduced you to these terms, and we will look at outcome and impact on the member states level. And these goals that I have put onto this slide have not been invented by Martin and me, but they are written down in our grant agreement. So these are the 4 important goals of our joint action. So improving capacities to implement prevention, involving key actors, and improving data system with a view to reducing social inequalities. But this is, really for us at the end of the ladder. So there are many rungs on the ladder that we need to climb in order to go to these, to come to these ultimate goals. And I will show the rungs in a second, but just with a view to evaluation. Now we're talking not about only the logic, but also about evaluation. In order to evaluate the success, so whether these goals could actually be reached within the joint action funding period, we will assess on the level of the member states whether capacities could be implemented, whether there was an impact on key actor involvement and on improvement of data systems. We will also include a couple of case studies, which we will follow very closely in order to see how implementation can take place in a successful way. We will also ask very individually which changes happened on different member states level. So as I said, these are the ultimate goals. Maybe we will not be able to reach all of those goals within the 4 years of funding period. So it's also important to look at the rungs on a ladder that may enable all of us to get there. And these are the clusters that I mentioned earlier on: the knowledge base, the capacity building, the pilot projects, and improved monitoring. So we will evaluate these outputs by asking the work package leaders and the task leaders to assess whether this was successful, by also asking the participating member states in the different work packages, but also by looking on the materials and the resources that come out of the work packages. So just to put it in a very simple way, what can we hope for when we already, think about what the final report may look like? I think that we will start writing the final report after 3.5 years. So obviously it will be very difficult to be able to state something like, our member states were able to reduce the cancer incidence or reduce the social gradient in the cancer incidence. So probably this this is what we all aspire to, and probably this can be, in the best case, implemented over the next maybe 5 to 10 years to come, but we won't be able to identify this mostly during the funding period. So rather we would look at things to be able to say something like this: participating member states are well equipped and on track to implement policies and programs to prevent cancer and NCDs. And it was the work packages activities that contributed to leveraging change in the individual member states. And we have selected case studies that can demonstrate that successful implementation can be effective in tackling NCD risk. So this is what we are expecting from our evaluation, that we can link the activities of the work packages to changes and enablement and resources that are really helpful for member states to bring across change. So evaluation always works with data. So what data will we use for the evaluation? We will collect data among work package leaders and task leaders as well. We will collect data among all those entities, affiliated entities, and people that are part of tasks and subtask groups, in order to see whether they can benefit from the processes that happen in the work packages. We will do this using quantitative and qualitative measures, such as surveys and interviews. We may also reach out to stakeholders in different countries who are not basically part of the joint action, but maybe are part of NGOs or administrations in different countries, and can give their perspective on what has happened or what the benefits of a joint action is, but we have to see whether this will be practical. And we will also, Martin mentioned that we will audit and check the materials that have come out of the joint action, and we will use innovative techniques such as the most significant change approach. But we're well aware that all work packages, all tasks and subtasks also collect a lot of data. For example, they need to give feedback on their progress regularly, and this will be put together by Work Package 1 with the progress monitoring. And I think many pilot studies have also planned to evaluate the success of the pilot studies. So we will also tap on those evaluation results. And every work package is also obliged to report on the indicators that have been decided on beforehand. So they are all in the grant agreement. And all this information will also be part of our final evaluation. So we will start to integrate the results from other work packages with the data that we collected ourselves. So just to give you, I had the feeling that somebody wanted to say something, or was that? Okay, then I was mistaken, sorry for that. So just to give you an idea what we will be looking at. For example, in terms of output evaluation, we talked about self-assessment. So what is self-assessment? We will survey work package leaders and task leaders on the accomplishments of the respective work packages. For example, so were you successful in reviewing best practices? Were you successful in finalizing a toolkit for whatever, setting-based health promotion? And we will do this with a written questionnaire, which will also include open-ended questions, because we're well aware that every task has different approaches to prevention, and we need to be sure to collect all the relevant information here. So questions that can be included in this questionnaires are: were meaningful resources developed? Were the pilot projects successful? How did the outputs relate to reducing inequalities, etc., etc.? So this would be questions that work package leaders and task leaders should be asking in order to assess their own processes in the work package. But we will also see what is the perspective of participants of the tasks, of the subtasks. So we might do that by focus group consultation with member states and ask them what is their view on the developed resources, on the models that came out of pilot projects. So The resources and the projects, were they adequate for the member states involved? Were they relevant? The toolkits, could they be easily utilized, or were they difficult to use? And what is also interesting to know for us, what is the added value of working jointly with other countries? So what was the additional benefit that came out of all those meetings, all those WebEx conferences and Teams conferences that we have throughout the joint action? So is there an added value of working jointly? I've mentioned the quality assessment, so we are really interested in the issue of knowledge translation. Because knowledge translation, I think, is a key factor of joint action. So is the joint action able to compile all the information that comes from all the member states into tools that are really hands-on, practical, usable for member states? And for this reason, we will take, probably not all, but a selection of guidelines, recommendations, toolboxes that are provided by the different work packages, and then audit them according to certain criteria. There are criteria out there in the literature on knowledge translation materials, for example, regarding the development process, regarding pilot tests, regarding conceptual frameworks, etc., etc. So we can really say whether the resources that come out of the joint action cohere with standards for knowledge translation. Yes, this all was on the level of outputs. Now I'll say a few words on the methods that we will use in order to evaluate outcome and impact. And for the evaluation of output and of impact and implementation, we will ask the member states' representatives using surveys or probably also interviews with the main questions: were you able, following the activities of the joint action, to plan and implement NCD prevention policies at different levels? And we will also do what we call change assessment, because we know that different countries start from different levels, from different starting points. So it's also important to see what were individual changes. So we will interview participants of member states, and we will use an approach which is called most significant change, asking member states what was the most important change that came across by working with the joint action, and how did this change relate to reducing inequalities. Maybe because this technique is not so familiar to everyone, the most significant change, I'll say a couple of words to that. Most significant change includes that we collect change stories. So we are really not interested in standardized data here, but in personal accounts of what has happened in member states as a consequence of being part of this joint action. And this means we have first to set a frame. So what is the main domain that we want to grasp with this personal account? For example, change in NCD surveillance or reducing health inequalities. And then we're asking a very simple question. During the last month or during the last year, so we'll have to decide on the time frame, or during the last 3 years of the joint action, what was the most significant change in reducing health disparities in your country? And the respondents are then encouraged to report why they consider that this was a very important change. And then we analyze these stories and we cluster them. And I think this is a really nice add-on with regard to reporting on results, because we can grasp changes that have not been anticipated beforehand. We can allow, as I said before, for different starting points of different countries. So maybe for one country, it can be a big step to now have ideas how to monitor risk factors, which is already a routine process in another country. So it's really important to allow for these different starting points, and we must not lose that out of our perspective. And we can generate, I think, really impressive qualitative evidence. So I've done this approach a couple of times in other health promotion activities, and it's really very impressive to have these individual change stories, so they can sort of add on to what we may see as dry indicators. Yes, and with this, I hand over to Martin again.
Brilliant. Thank you so much, Julika. What Julika has presented is the heart and the core of our evaluation activities, but we are thinking further, and so we identified some add-on evaluation approaches. These are two. The first one are the implementation case studies. We were already in exchange, by the way, with the WHO, and we agreed with them that we should identify some promising examples of intervention studies within our joint action. Julika mentioned that there are more than 90 pilot projects in the joint action. We are not going to evaluate the pilot itself, but we will closely collaborate with the work packages and task leads who are doing the evaluation on their implementation case studies, focusing on the process of implementation. And this is really important, the influence of contextual factors. We will use to do so a mixed method approach, and to help us identify what promising examples of front runners, or whatever you want to call them, could be, there need to be eligible. So it could be concrete cancer or NCD policies should include that. And also there should be sufficient information and documents that can be provided so that it's useful to evaluate those implementation case studies. And what do we want to do with that in a further step? If you click one time, please. Perfect, thank you. We want to publish some highlights to gain some visibility and also impact. We want to publish some promising examples of our implementation case studies on the best practice portal of the European Commission. This was also suggested by some colleagues from the European Commission, so it would be really, really nice to have those published there. And to do so, the OECD developed some evaluation criteria to see if our case studies that we suggest to publish are eligible to be published on the best practice portal. Our second evaluation approach that we add to our plan is the external evaluation, so subcontracting. And we were thinking, what could be the content of our external evaluation? So we thought about assessing the organization of our activities and mainly focusing on the mandatory work packages. 1, the coordination; 2, dissemination; 3, ourselves, the evaluation; and 4, the sustainability. Because if we assess how we do it, we are biased. So we thought it's could be a good topic to outsource to an external agency to measure those, the coordination and the management, but also overarching activities for collaboration and information exchange within the project. We will use structured interviews and/or standardized surveys among work package leaders, and we will really closely working together with all of the work packages involved, as well as with the stakeholders. I mentioned that at the beginning, and it's always important, every evaluation step, you should include the target groups of your activities, as well as all the stakeholders that it's involved. What could be evaluation questions or contents of the questions? It's quality of selected workshops, for example, like the one today, effectiveness of our communication, and dissemination on different platforms using different formats, the usability of our templates that we are developing, and the satisfaction with the overall coordination of our activities, for example, the work package structure that we are using, or implemented boards that we implemented in the joint action. For example, we have a data management board, we have an ethics board, we have an equity group, and so on and so forth, to really see, are we working successfully? Are we working effectively? And that will be done 2 times within the joint action, so that we can adapt, right? That if some challenges arise, we can react to that and do it in a better way in the future in the funding period. Next slide, please. And there's some topics on top of that that we want to tackle. This could be benefits and challenges of the work package structure. I mentioned that could be a topic for the external evaluation, but there are some things that we need to do that we can't outsource to external agency. And this is, for example, outreach of our activities beyond health. So intersectoral work. Are we addressing all the other actors, stakeholders in other sectors than health? For example, environment, for example, traffic, for example, nutrition, right? So we want to really structure our intersectoral approach and see if we were successful in doing so. And on top of that, we want to align with big public health strategies. This is not only on the member state level and their strategies with regards to public health, but it's also, and really important, on the European level and these activities that are going on the European level. We have to align with those processes because we have to fit in there. We have to fit in there with what we are doing. And this is just possible if we know what is going on in this area, and we are tailoring our activities to what is being provided within other project or in strategies of the European Union. And then it's about where will be our results documented. Yeah, next to publications, of course, next to conference papers, to some other formats that we will develop within the project time. We will have some mandatory evaluation activities with regards to an evaluation plan. We published that in June this year, and we have 2 interim reports, one in 2025 and one in 2026, where we give you the status quo of how we are developing within the joint action. And we have a final report at the end of 2027, where we sum up all of our activities, all of our results, synthesizing the work on the process evaluation from work package 1. So these will be the main documents that we will develop to share the information that we gathered. And on the next slide, how can we structure this report? Right? Of course, we could do it and just list all the activities that we have done, but we want to have an impact with our evaluation report. So we are talking a lot about cross-cutting topics within the joint action. We are looking at different risk factors. You see them here. It's smoking, it's alcohol consumption, nutrition, physical inactivity, and social disadvantage. And we are thinking of structuring our report with regards to also these cross-cutting topics. And I know that the work packages are already working closely together, so it will be nice to put all these risk factors together and structure our document this way. And now the timeline. This is for importance, especially for the participants of the joint action, that you can somehow expect when we are going to reach out to you, when we are having our milestones and deliverables, so that you are prepared that you will receive something from us. On top, there are the milestones and the reports. I talked about that already. And one of the first next steps, and an important one, that we are conducting right at the moment, these are bilateral meetings with the work package leads. This project is broad, so we have to be in contact and exchange. And we ask the work packages about their evaluation activities. What are you doing in your work package? Do you have some evaluation activities going on? Where can we add to each other? What could be the added value of your work? How can we support? And also on the case study implementation, what could be a highlight or a promising implementation case study that will deliver some results early as possible to evaluate those. And also, this is an important point, and we are developing a framework for that, unintended effects of the joint action itself. We are talking about the work about that as well. And then the self-assessment of the outputs of the joint action. We will do that in June 2025. So we will send you a survey, and we will ask you to fill it in. And then capacity building. This is really important that you also do some internal capacity building on evaluation. So we will conduct hands-on evaluation workshops, and it's not from our perspective what is important for us that we are going to present to you. It's about your needs. What do you need from us? Where can we support you? What are your evaluation needs within your work package, so we can tailor this workshop to your needs. This is the intention behind that, to build capacity within our consortium. And the next steps in 2025 is setting up the external evaluation. That's the call for tender. It is being included, and all the preparation processes that are needed are supposed to be set up until fall 2025, so we can conduct the external evaluation. And last but not least, in 2025, it's the focus groups that we are intending to consult to do the peer assessment of the resources and the meaningful resources we have developed so far by then. On the way, you won't see those activities on top of the slide, because this is an ongoing activity during the whole time. This is the quality assessment of the materials. We will start that as soon as we have a critical mass, because it doesn't make sense to just go, yeah, there is one. We will wait until we have a number of documents to assess, and then we will conduct that during the 4 years. And the implementation case studies, I talked about that. This will be also important to know, when are your implementation case studies done, when you have your results, and we will then adapt to that in our timeline, and we will include that in the evaluation. And for 2026 and 2027, there again, the interim report and the final reports, but more importantly, is the external evaluation, the first one, and the results should be gathered by the beginning of 2026. This is coherent and is aligning with our internal reporting processes within the joint action, so we can add to that. We will have a hands-on workshop again in 2026 to see what has developed, which problems came up. The safe assessment on the outcomes of the work package. So then we leave the area of outputs, and then we come to outcomes and impact. This is going to be the self-assessment. I don't have to explain that again. Julika did it really nicely. Another external evaluation in 2027. We have to do it quite early in 2027, because of course we want to include those in our final reports. So we need some time to draft them. And at the end, interviews on the significant changes using the most significant change technique that Julika has described already. So this is our timeline with our main milestones, internal milestones, and you get a better overview. What are we doing right now? What are we working on? Not just what are our plans, but also what are our outcomes in the evaluation work package. I talked about the bilateral meetings. We already conducted some, and it's running really nicely. It's a really great collaboration. Thank you to all work package leads that were included so far, and task leads. And then we have to do, and we are on it, we have to comply with ethical and data protection requirements on the national level. These are quite strict, so we need some time to prepare the documents for informed consent, for the scope and purpose of our evaluation activities. So we have this available by next year, as soon as we send out our first questionnaire. And as I said, the detailed protocol is being drafted, including all these important information, and this will be shared as well. And last but not least, it's the developing and pre-testing of the questionnaires and the interview guides. We will do that before we send out our questionnaires and conduct our interviews. So thank you so much. And the last word is yours, Julika.
Yeah, thank you, Martin. So I think we've come a long way from sitting in front of the grant proposal and asking ourselves, how the hell could we find an entry point for evaluation, to have an idea how to do that. And I think the real work will start next year, and we are more than happy that we were able to hire 2 excellent colleagues, Meg and Zeman. They are already here with us today in the seminar, as I saw, and they will start in January, and then we really have a team of the evaluation work package, because so far Martin and I have done that on top of our other work. So I think we will really start with the meetings, with the workshops, and with the surveys next year, and we're absolutely looking forward to working with all of you and really to making this evaluation valuable to all of you. So the evaluation should not be a burden on your work. It should be something that is valuable to you, whose outcomes are important to you and meaningful to you. So it should really assist our all work in the joint action. So and if this is not the case, please don't hesitate to contact us. Thank you very much. And now we have a quarter of an hour left for questions. And I think Svenja will coordinate that. Thank you very much.
Yes, I see one risen hand, so I will see if I can just open your mic. I think you should be able to speak now. Maybe you need to activate your mic as well.
Can you hear me now?
Yes.
Yes, thank you so much. It's such a pleasure to be here today. My name is Elizabeth Weidepas, and I'm in the Scientific Advisory Board. And I'm really impressed by what you presented. It's very professional, very thought over, very solid, and I hope it will be extremely useful for evaluating this mega project, very complex project, but also for each of the participants to learn how to properly evaluate things based on your tremendous experience. My request would be, can you share the slides so that we can revise them, study them, and learn from them already now, and consider this also for our board work, but also for each of the work package members' work, because there are lots of terminology which are new for us, and that we certainly would like to dig deeper. So if I don't know if it's Svenja or who is the coordinating, or if it's you, Yuli, Julika, or Martin. So that would be my plea today. Thank you so much for your attention.
Yeah, thank you very much. And thank you also very much for your nice comment. Yes, and we are more than happy to share the slides. Maybe they are even shared on the Joint Action website in the internal area. I guess that's where it could be accessed, but we can also send them around.
It's okay. The next question is by Chabelle, and I think I need to put you in the discussion board to be able to speak. So please wait for me to do that, and then you're able. But I think you should be able to talk now, Chabelle.
Hi, can you hear me?
Yes.
Okay, hi guys. I think this is an impressive actually work that you're doing. The plan is very exhaustive and has very interesting, also it's very interesting what you have chosen to focus on and how to design your evaluation. I have first a technical question about the joint action itself, actually, because of your first output level that you had, which is identify, map, and review best practices. Can I ask, so this is just curiosity in comparison to the joint action we are evaluating, the JHII, what platform do you use to help disseminate this kind of knowledge that the joint action is basically, putting together and working on? Is there a specific platform that you're using for that to bring all that, basically bring all the member states to the same level? And on the same output, because you're going to be looking at all the information related to prevention of NCDs, how do you actually engage with medical associations who usually put out recommendations or guidelines for how these things have to happen? So this is more on the technical side. In terms of the evaluation itself, so I see that you're quite focused on the process and the implementation in terms of the biggest bulk of what you're looking at, which I also find very useful and very, very attractive. I'm wondering a bit now that you are at that stage of designing your data collection tools and questions, etc., what theoretical frameworks have you used to put together or decide how to direct your questions, and then also what theoretical frameworks that will help you later on situate your findings? And one of the more interesting questions for me is, how do you consider investigating the design itself of the joint action as part of trying to explain, once you focus on implementation, what is impeding the implementation or what's enabling the implementation? This is too many questions, but feel free to address as many as you want. Thank you.
Yes, thank you, Chabel. Maybe to the other participants of that webinar, Chabel is also working at Robert Koch Institute, and he's leading the evaluation of another joint action. So he's not properly part of this joint action, but he's obviously very interested in the aviation part. Hi, Chabel. Yes, I think the platform for disseminating the resources that are prepared within the joint action will be provided by work package to the communication platform, and maybe we can establish a contact here if you're interested. And the framework for, I think the framework for evaluation, we based our framework on publications on evaluating complex interventions. So that is and health promotion. So we digged into that, and if you're interested, we are in the process of writing a paper on the scientific background of the evaluation, and this will be published in a special issue in the Scandinavian Journal of Public Health. Work Package 1 is coordinating this special issue, so we have our manuscript ready, which is in the review process, so we can provide that to you. And what else? Do you remember another question?
My question was about the design, basically, if that's going to be a focus of your investigation, the design of the joint action.
Yes, actually, to be honest, we haven't really found a design to question that, because this came up in the meeting with the scientific advisory board, which took place by the end of September. So we took that up as new novel question to us, and we will, I think, need a bit of brainstorming to come up with an idea how to best measure that. Maybe this could be done by the external evaluation. I'm not that sure.
Yeah, maybe, Jurika, as a context, especially when I get to the implementation part in an evaluation, what we notice that very often you bump into obstacles that prevent or basically hinder the implementation of an intervention that you can often link to how actually the intervention itself was designed. And not only implementation gets affected by how an intervention was designed, but also its potential for sustainability. There's a lot of frameworks on that show you to which extent pre-steps, so steps before starting the implementation will be very relevant, actually, especially during the design stage, of how you set for a higher potential of sustainability, but also many of the steps taken in the design, especially about whether you had a collaborative process to design the joint action, whether every member that you're seeing now in the, like every member states or competent authority you see in the joint action work packages, whether they were also involved from the beginning, knowing what is it that they're getting into, etc., because that will affect which extent they can deliver. And so this is why we had decided in our joint action and our evaluation to also collect information on that, to try, once we have our implementation results, to try to situate why are we seeing certain things or not. That's just from our side. Thank you.
Yes, thank you, Chabel. And I think implementation science has given us quite a number of tools and perspectives how to look into these processes. So our evaluation design is also informed by implementation science. So we can also use that, for a bird's eye perspective on the joint action itself. So that's a good idea. Thank you very much.
Maybe building on what Julika had said, Chabel, we have some documents that might be of interest for you. You were talking about platforms for dissemination. Our work package on dissemination and communication did a stakeholder analysis, which is really useful for us to identify, for example, you mentioned medical association, to identify the stakeholders that we have to reach with our activities. And they also provided a dissemination plan in which the formats and our communication channels are posted. I can share those documents with you. And with regards to the intervention designs, Work Package 6 on healthy environments developed a monitoring template to follow up on their activities, which is really nice in different steps. So that could be also of interest for us, of course, but also maybe of interest for you. And we have a sustainability template by the Work Package 4. They developed a template, a table in where they collect all the sustainability elements within the joint action projects, pilots. So this could be nice.
So very quickly, just to make sure, I meant the design of the joint action, huh? Not the evaluation. Okay. That's what I was referring to. Thank you.
Yeah, thank you.
Okay, we have one more question. And Finn, I think you should be able to unmute yourself. We can't hear you yet. No, I see that it says you're unmuted, but there's no sound.
We're waiting for you to write in the chat.
Maybe you could try to just leave the meeting and then join again very quickly. And then while you do so, I have two things from the chat I'd like to share. One is the reminder that local stakeholders do not necessarily speak English, and that this is something to consider for dissemination. And the other one is the question when this webinar will be published. I think the answer is within the next days, probably. I don't know whether that's your responsibility or someone else's, but you can say something about that.
We'll organize this together with our colleagues from Norway, and it will be as soon as possible.
Okay, so we hope that Finn will be able to. Now? Let's see. Hello?
No, I can't see anything. No. So sorry, Anfinn, maybe you can type into the chat.
Okay, we will have the next 3 years to talk. This is true.
Okay. Yeah, so this is a good, these are good final words. I think we have 3 more years to talk and to discuss and to evaluate, and we're absolutely looking forward to it. Thank you very much, everybody. I think we're well on time. No more questions coming up, Svenja, as I see.
There is one remark in the chat, one last one, to address to you and Chabelle. We at the Health and the Innovation Center in Denmark have experience with process evaluation and approaches to this, which would be the one that can inform the project along the way, also in terms of designs and current methods used, and would be part of a formative type of evaluation. Let me be part of this discussion if there are meetings planned to discuss this further. So another offer for collaboration. We will. I will copy the chat so that this is documented for further networking.
Yeah. Thank you very much, everybody. Martin?
Yeah, thank you so much. It was a pleasure to present today, and thank you for your help and support and for all the exchange that we had within the last year, and I'm looking forward to the next 3 years together with you. Thank you so much. Bye-bye. Have a great weekend.